For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hi everybody, thank you for joining us. I'm Larry Little. We begin this morning with a focus on testing here in Santa Clara County. I'm joined this morning by Chrissy Cheung, the testing branch director here at the EOC's testing operations, and she will discuss this morning the safety at our testing locations, where and why you should be tested. But first, we want to let you know that safety is a priority for us here at the EOC, but we have removed our face covering so everyone, including our American Sign Language interpreters, can clearly and properly communicate the information that we will be sharing this morning. Chrissy, thank you for being here.
Thank you for having me.
I know it's been a busy time these last 7-8 months.
Yes.
So we just want to talk about testing a little bit. Who should be getting tested?
So, we have really done a lot of work in the last several months to expand our testing capacity. So, there are several groups of people that should be getting tested. One, if you're symptomatic, you need to get tested. If you are a close contact to a case, then you also should be getting tested. Also, if you are our frontline or essential worker, you should also be tested regularly as well.
So there been a lot of misconceptions about the testing centers. A lot of people feel, well, there are going to be a lot of people at the testing center, so there's a possibility I could be exposed when I go to the testing center, and that's just absolutely not true. So just talk about the safety at the testing centers.
Right, so we definitely have been hearing that a lot from community members, and I do want to ensure everybody that that is absolutely a myth. We take great care in ensuring safety for all of the residents and people who come to our testing centers to get tested. So, we make sure that there is enough space at our testing centers so that people can be physically distanced at least 6 feet apart, especially when they're waiting in line, when they're waiting to get tested, when they're filling out any type of paperwork. Also, everybody needs to be masked when they come to our test sites. And also for our test sites, the ones where you walk in to a test site, you have to park, get out of your car and go into the test site. We only test asymptomatic people there. So if you're sick, we actually have to turn people away from those sites. We do have options for people who are sick, who do have symptoms or are feeling ill. Our fairgrounds site, we have, it's predominantly a drive-through site. So because it's a drive-through and you're kind of enclosed in your car, it makes it safe for people who are going to these test sites if you're symptomatic to get tested there.
And I did use the drive-through testing center before, and the operation there is magnificent. And everybody's doing a great job, and you're going to be safe when you go to these testing centers. I had arranged for graffiti, confetti, not graffiti.
I was waiting. Which one of our testing sites will there be graffiti at? Okay.
That's another situation.
Yes.
But I had arranged for confetti to fall from the ceiling, but management didn't approve it. But we have conducted over 1 million tests here in Santa Clara County.
Right.
Talk about that. That's very exciting.
Yeah, that's actually very exciting. And I think just in light of thinking back to early in the pandemic, early this year, it was just so hard to get a test, right? So over the last several months, we really have been building capacity, whether it's capacity in our labs. VMC has been a great partner for us. Our public health lab has been building capacity, and that's something that we really have been able to do in partnership with a lot of county partners, a lot of people who are external to our county as well. So I think for our county sites, between our fairgrounds site, which now can test 2,500 people a day, and eventually it can test up to 3,000, 4,000 people a day, which is very exciting for us. We have pop-up sites where we have testing where you can just drop in, no appointment. We have sites in East San Jose and in Gilroy. We also are partnering with our cities. So in the cities where we don't have a pop-up site, we are partnering with them to have a test site regularly with each of those locations. And we also are working continually to build capacity to work with the state. The state also offers resources to us to expand testing, and we really want to be able to have accessible, free, fast, easy testing for everybody who lives, works, or goes to school in our county. So 1 million is absolutely a tremendous accomplishment, and there's just a lot of people that we have to thank for that.
Yeah, we've done over 1 million tests, but I want to admit that probably about 20 of those million have been from me. So it's
being safe. You are one of our frontline workers.
I really appreciate that we've made testing so accessible here in the county to all community members. So why should people be getting tested? I know everyone's looking at election results right now,
right,
and our attention has been taken away from it a little bit, not as much talk about COVID. So talk about why it's important to be getting tested, and,
right,
and why should people be getting tested on a regular basis?
Right, so testing is actually a really essential tool for us in public health. So being able to test will help us identify people who are infected, ensure people who are infected, who are sick, will receive appropriate care. It helps tremendously in contact tracing and case investigation. We want to ensure people who are sick are able to protect those who are around them, their family members, household members, and other close contacts. And it really is one of the tools that we can use to help contain and prevent the spread of COVID-19. One of the important things about getting tested regularly, especially for our frontline workers, and frontline workers are people who work and interact regularly with the public, right? So that includes people who work in our grocery stores, people who work in our restaurants, right? People who do delivery, our educators who are in schools, and first responders. So everybody who has regular interaction. It's important for our frontline workers to get tested regularly. So what we do recommend is to get tested at least once a month, and no more than every 2 weeks, right? Unless you are in a very high-risk situation, high-risk exposure situation, or you work with vulnerable populations. We do recommend that people get tested regularly, because you are regularly exposed to people who may be sick, and because we have we also have asymptomatic transmission going on. It's just safe. It's to protect yourself. It's to protect your family members. It's to protect your coworkers. Also protect the people that you come into contact with.
Earlier this week, we did a show on gatherings, and with it being people celebrating, moving toward the holidays, and also with politics as well, people may gather more so in the coming days. What is your advice to people who gather as far as when it comes to getting tested?
Right. So I think that there's plenty of guidelines for us, and the county has put out guidelines for safe gatherings, right? So make sure that there is enough space for social distancing. Make sure that you're wearing your mask. Outdoors is always safer than indoors. But if you have attended one of these large gatherings and you think that you may have been exposed or to a close contact with somebody who tested positive for COVID, the first thing that you should do is to keep your family safe is to quarantine as best as you can. And that really is to prevent exposing others if you have in fact been exposed. So what we do recommend is after a large gathering, quarantine yourself to make sure that you're safe, and then about 7 days after potential exposure, then you should be able to get tested.
Thanks so much. So let's talk about there was an order mandating that healthcare facilities provide testing to community members here. Could you just discuss that order, share a little bit of details about that order with us, so people know that you don't have to use one of our testing centers. You can actually go to your provider and be tested.
Right, absolutely. So the testing order that came a couple of months ago in September, it really is to help encourage our healthcare facilities to increase their testing. So based on the testing order, there are the healthcare facilities are required to test people that are kind of under their care population. So if you are symptomatic, if you are a close contact to a case, if public health has referred you and requested that you go get tested, and also if you are a frontline or essential worker, then healthcare facilities under the testing order are required to test you.
And what if someone is turned away from one of those locations?
Right, so if people are turned away from those locations, we have our online portal, SCC COVID Concerns, and that is one way to let us know that you were turned away from a healthcare facility and you were unable to get tested, and that will help us also reach out to our partners, to reach out to our healthcare systems, to see what's going on, to see how we can kind of encourage a partnership that we are able to get everybody in our county access to testing.
And you can always go to scfreetest.org for information about testing here in the county. And it's a good idea too, if you're going to use one of the county locations, to take your insurance card with you, just so they can get the information, and
Yes.
it comes out separately. I don't want to get into that, but you're not charged for it. But it helps because a lot of people, they need a test immediately. They need it done immediately. They don't want to set up an appointment, which could take some time. Well, thank you so much. Do you have any closing information to share with us?
You know what, I just want to remind people that we do have a lot of resources for testing in our county. So you are able to get tested. I've also heard people that are afraid to get tested because they don't want that swab that goes all the way up to the back. All of our county test sites are using the nasal swab, so it's a fast, easy test. So we really encourage, if you are a frontline worker, if you have regular interactions with the public, please get tested regularly. And as always, we have to continue to wear our mask, use social distancing, and those are really the tools that we have in public health to protect ourselves and to prevent the spread of COVID.
Yeah, and testing is really simple,
Absolutely.
it's easy, and it's very comfortable, because if it were not comfortable, I don't think I would want to do it.
It is comfortable. Yes,
very comfortable,
yes,
very gentle process, no pain at all.
Absolutely.
All right, thank you so much for being here. Of course, we will have you back. We want to remind everybody, it's very important for you to be tested, because we have to slow the spread, and that starts with knowing your status, as well as following some of the protocols that have been set forth by the county and reducing the spread. I was looking at an article today here from KCRA, and what we don't want to do is, this article is about Shasta and Palomas County moving back into a more restrictive tier, and we definitely do not want to do that. We want to continue to advance and eventually move to the yellow tier here in Santa Clara County. All right, well, that's going to do it for this edition of Live with the County of Santa Clara. Our edition in Spanish comes up at 11 o'clock, as well on Thursdays at 10 a.m. in Vietnamese. Thanks for watching, everyone. Have a good weekend.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.